I think one of the things that we've done at Meridian is try to remove the barriers for somebody who is contemplating whether or not they have an addiction. We talk about the stages of change in our field, where somebody who's not aware that they have a problem is considered to be pre-contemplative. They're very defensive. They hold their addiction close and they kind of thwart off any feedback about it, positive or negative. And then the person who's contemplative, that's kind of like, they're aware that there's been some problems. They may be getting in some trouble at work. Their spouse may be expressing some dissatisfaction in the relationship, but they're afraid, or they're not entirely sure that they're ready to give it up. Something that we've done for that contemplative person at Meridian is we offer free consultations. So I would encourage that person to come in and just talk. We can't lock you up. Unless you're in jail or you've been, civilly committed to a state mental hospital, you can leave. We cannot hold you there against your will. Might the court encourage you if you have charges? Sure, and you may end up getting incarcerated, but from our respect and our standpoint, we want to just be able to talk to you. So if you come in and you say, I don't know if I have a problem, but here's what's going on in my life, we can sit down and do that. You don't have to be a client. You don't have to have a full assessment. We just want to be able to assist you in talking through what's making you uncomfortable. So an assessment would look like me just asking you a series of questions related to your living environment, who supports you, what substances you're using and how long you've been using them, to understand, what level of a relationship do you have? Are you physically dependent, psychologically dependent on that substance? And it's, again, I'm not judging you. I just want to understand what's your relationship with the substance, and I'd need to know everything from beginning to end. Your treatment history, I'd want to know if you've ever had treatment before. Mental health history, do you experience symptoms of anxiety or depression? And if you don't know what those are, I'd work with you and educate you on what they might look like and how they might feel, because that's important for us to understand those things in the context of your substance use. If you've ever tried to harm yourself or somebody else, any harm to self, we want to make sure that you're safe and that you're keeping other people safe too. And understanding, do you have a job? What are you wanting to do? We look at your strengths, what's available to you as a person, what your needs are. Depending upon the level of care that this person would need. So, say you need residential, and you're willing to do it, but you're afraid of what your family, your boss, or other people would say, we would help you through that. We are mandated to keep your information private, and we wouldn't share that with anybody without your written permission. But some of our folks want some supports and want some assistance in talking to their family members about what their addiction looks like and what the treatment plan would be for you. So we would sit down and have a conversation about what you're comfortable with, what are the next steps. We can do a family session, bringing your family in and sitting down and talking through what the recommendations are and what treatment will look like. As far as an employer is concerned, family medical leave is something that can be applied for, and it doesn't necessarily have to be disclosed that it's for addiction. It can be for a condition, a chronic condition. There are things that we can do between our medical team and our mental health and addiction team to help you navigate that. If it's outpatient, we've experienced that quite a bit, where we're helping somebody help their family understand what it is. If there's work obligations, we can help working around a work schedule, so you're not necessarily having to report off. Outpatient is day, evening, early mornings. We can work around a work schedule for sure to help an individual. But it's when you get into residential and detox where an individual may be concerned about the barriers and who has to know and how they'll find out. And we work with people all the time to try and figure that out for them.